Up next, we have a presentation from Tommy Bunt, Corey Straub, Juliet Foucher, Romy Verschoor on abstract research staff satellite meetings.
Welcome to the next presentation, which covers the ALS Clinical Trial Staff Network, an international collaborative project. So we will talk you through in this presentation about, of course, first we introduce ourselves, followed by why we started this initiative. We will give insight into our first meeting, and we will then follow with the next steps, and we will conclude with something surprising. So who are we? This organizing committee consists of myself. I'm a physician assistant located in the Netherlands, and I'm also linked to TriKels as a trainer. The next participant was Romy. She's a project manager at TriKels, followed by Juliet. She is a ALS clinical trial coordinator and PhD student, and she is located in Stockholm, Sweden, and linked to the Karolinska University Hospital. We had three participants from Canada. The first one was Matthias. He is also a clinical trial coordinator located in Montreal, Canada, and linked to the clinical research unit, together with his colleague Vanessa. She's also a clinical trial coordinator and also linked to the clinical research unit in Montreal, Canada. And lastly, we had Corey, who is linked to Corrales Corp.
So to give you a bit of a background on how we started this work group, we were all familiar with each other through conferences or different meetings we had attended. And by starting talking to each other, we realized there was no specific network for ALS research staff members. So we realized there was a gap to fill. And by discussing, we realized we did have things to bring to the table. Our main strength was that we had members who were coming from different hospitals, different countries, and so on, making this experience extremely global, but focusing around one same patient population with ALS patients. Our goal was to create a shared space to discuss and exchange experiences and learn from them, and also to harmonize approaches to ALS trial coordination globally. So this led us to think, how can we take those discussions and move toward the first ALS clinical trial staff network? This takes us to February last year, 2022, where we had our first meeting with the organizing committee members. We introduced each other. We kind of gave an overview of our own experiences with ALS patients, ALS advocacy, ALS work, and ALS clinical trials. And after several meetings in May, we came up with a questionnaire that we built to collect a few data. So some of this data was, for example, for the questionnaire to allow us to collect information on infrastructure, patient volume, number of staff members, number of trials. And this was really useful for us, so we could have a good information on the level of the teams, the size of the teams. Are they used to seeing a lot of patients? Do they have a large number of staff? Do they host a lot of clinical trials for ALS? And we sent this questionnaire before meeting everyone at NCALS in Edinburgh in last summer. We had 4 topics to center the discussion around. First topic of the discussion on the agenda was general training and certification for clinical trials, and this was very much led by Tommy, who is a TriKels trainer, so very useful for that point. And then second topic that we had was site management. So we discussed about everything we can encounter when we are a trial staff member when it comes to clinical fund management, from supply to handling staff to handling clinical trial visits. Third point was international patient inclusion. So this was a very interesting debate point in our meeting. And fourth and last topic of discussion was interaction with sponsors and CROs.
So how did we work our way through these 4 topics? To just give you an insight, for each topic, we did a 4 steps process. So first, we started with a general introduction of one of the committee members, what we expected from the attendees. Later, we just made subgroups to ensure that every attendee were able to speak out, which we were a bit afraid if we just would not happen if we just have each other in a large group. So after the subgroups were created, we went to different sections in the conference center, and they were guided with one of the organizing committee members, just to ensure that the entire topic was covered. Later, when they had this discussion, which lasted approximately 15 to 20 minutes, we brought everyone back after each topic to just share information that was gathered across subgroups, and which gave an interesting interaction. And we saw that each different subgroup discussed the topics differently. So it was also interesting to see how the topics were covered by each subgroup. So what we gathered from this meeting is that there were 11 ALS clinical research centers present, and the following represented by the following countries. The centers were located in Sweden, Ireland, the Netherlands, Slovenia, Denmark, the United Kingdom, represented by both Scotland and England, Switzerland, and at last Canada. And what we have learned is that 90% of the research centers proposed for future meetings to cover both clinical care and research topics. We also figured out that none of the European centers had a specific startup nor clinical ethical team. This in contrast with Canada, and probably Matthias can just share some of his experience.
Yeah, coming from a North American clinical research site, it was important for us to exchange and discuss about the conduct of a clinical trial in Europe. We really realized that there's a lot of difference between North American sites and European ones, but also from within the sites in the same country. So the NCALS satellite meeting really sparked the idea of having a similar network in North America and potentially a global network. So we already reached out to our partners at NCALS and also coordinators at the NEALS conference to create a virtual kickoff meeting in January for NCALS 2023.
And we're really hoping that this becomes a dynamic initiative. It's constantly growing, it's constantly improving, and ultimately bettering the landscape for clinical trials. So our goal for the 2023 season is to have representation at the 4 major international symposia on ALS: NCALS, PACTALS, NEALS, and ALS&MD. We'll be redoing the satellite meeting that was conducted in Edinburgh at the 2022 NCALS, in 2023 in Barcelona. But we're also hoping to be able to present the initiative at PACTALS and begin to build the network out in the Pan-Asian community, as well as at NEALS and at next year's ALS&MD. We'd like to make a call out at the same time if anyone has any suggestions for potentially South American or African sites so that we can build a network truly globally. Because ultimately, the goal of this global approach is to harmonize approaches and improve the clinical trial landscape for everyone, especially the patients. And as Tommy mentioned, we do have a bit of a surprise at the very end. We've begun to come up with a name and a logo for this network, which we are calling INARC, the International Network for ALS Research and Care. Thank you all for your time today. If anyone is interested in the network, myself, Matthias, and Vanessa will be here in person. Juliette, Tommy, and Romy are available virtually, and we would love to get any feedback that you have. Thank you.
Thank you.
Thank you.
Thank you.
Too fast for me. So yes, I think you are going to have a lot of people who would be very interested. So maybe there's a way that we reach out. Do we email you, text? How do we reach out? Somebody's raising his hand.
Address that question, and we anticipate that question. So what we have launched is like our own email address, so that we can not like have it ending up in a single person's email box. So we have like a general email address which can be announced by Romy, so that people can reach out to us.
Yes, it's enarc@tricos.org.
Just writing down. Any questions from the audience? Over here, Corian.
Thank you very much for, Jan Blonk, Dutch ALS Foundation. Thank you very much for your presentation. Great initiative to share ideas and information with each other. What are your goals or on expanding the people that are joining? Because you, there are some parts in the world that you don't, that are not in the group yet, as far as I understand.
Maybe I can address this one. Hi, Gaëtienne. Very nice to have your question. So absolutely, and that's why now our aim for 2023 and the years to come is for us to be more present to different conferences. So let's start, what we have in mind is to start building a strong connection with the Pan-Asian ALS community in research. And as Corey was saying at the end of the presentation, we also want to build connection with the African centers. And the goal is to learn from our different experiences. So I am sure we have different practices in Africa and in Asia. And so that's why we're really now trying to find co-partners from those regions to build the network even more.
Yeah, I think this is the right meeting for that. There's a question online.
Yes, this is from Roderick. I have PLS. My friend has Kennedy's. ALS is intrinsic in your title? ?
So I think right now the goal, because the team is built largely of ALS research coordinators, was to start out with an ALS research coordinator and care team network, which could exchange their experiences in the trial landscape specifically for ALS. But I think if the network takes off as we hope it will, it could be a great model for other disease indications, or it could even grow to incorporate other disease indications.
Lauren? While the microphone is going to her, I'll ask, what do you guys think about the previous presentation and getting these, once you get these experts and evaluators together, looking at the ALS-FRSR and how it's administered?
No, I think it's great, and that's kind of the exact goal of this initiative. Actually, Tommy, I know, was present at the ALS-FRS kind of harmonization meeting that happened this summer. Yeah.
He had to train me in harmonization.
Yeah. So I can, I think, and I'm in Spain, in Barcelona, at an investigators meeting where we just discussed today the ALS-FRSR. And that was done by Jeremy Scheffner, who you're all familiar with. And even we had this summer, we took the summer together with Gail, Jeremy, Leonard and myself and Angela to harmonize the ALS-FRSR. It raised questions. And I think that's what we will have happen with the ALS-FRSR and will continue to happen if with the ALS-FRSR there will always be questions that will not address in the SOP that due to the heterogeneity of the disease. So what I think is good to just have these discussions ongoing, and I think it's too idealistic to come up with a resolution for each and every example. But I think it's what we try to do is just with our standard operating procedure, guide people and apply that to certain situations. And what we not try to do is list every specific situation into that SOP.
Right, right. I think it would be very important that you meet with the actual evaluators versus Jeremy, Angela. I mean, they're fantastic, but the people who are actually administering it.
Another question from the audience?
Yes, Lauren?
So Lauren from Les Turner. I used to be a pediatric clinical coordinator in the neuromuscular field, and that was exactly my question. I mean, they had definite a lot of inter-rater reliability. That was the majority of a lot of the training was training the people who are administering. So I'm really excited that that's a consideration. But the other question that I had is. One of the things that I saw in the pediatric space was the involvement and the engagement of social workers to enhance recruitment and retention, to be able to support the clinical research professionals. I think that capacity building and workforce development is a really critical issue, and I'm so excited to hear about your group, so thank you.
Another question from the audience?
What are the requirements to get clinical trials to other countries to participate?
If I can address that question. So, and of course, the other team members, please feel free to add on. What I think what the network does is we exchange experience, how we conduct the clinical trial work. How do you set up the clinical trial teams? And we did that with the background is, as we explained in the presentation, just to learn from each other. So with building a strong clinical research team, we believe that also attracts or at least build the infrastructure to conduct clinical trials. And of course, that not necessarily attracts clinical trials, but then at least what a team can broadcast to, for example, to sponsors or to industry or partners, to say, well, we are ready to take on a trial. We have the patients, we have the structure to conduct a trial.
Any other questions? Jorjan?
Yeah, to get this worldwide presence in clinical trials, of course, it's not easy to go into Africa or South America. What help can you use from people here in the room or for the Alliance to get a worldwide presence in your new initiative?
Yeah, I would say, I called out at the end of the presentation, connections is what's best for us right now. So if you know of anyone that you can connect us with, or if you know of sites that you think would be interested in this initiative, we would love to get those names and start reaching out to people to start building those connections and building up the network in that way.
And just to add on to that, we will have our kickoff meeting in January in 2023 to start planning the next season. So right now is also really the time to connect and for us to work on connections. So please send an email to the address Romy shared earlier, and we'll be very happy to answer and initiate discussions with you all.
All right, anyone else? I mean, I think this is fabulous because, again, coming here and being in the room with all these allied health professionals plus is a way that we can all learn from each other and really network, and then this is just going to add on to that. So thank you so much.
Thank you.